Test 1 2 3. Testing 3 2 1.
We do not have any citizens wishing to address the committee. So our next on our agenda is approval of the minutes. Are there any corrections to the minutes? Are there any corrections to the minutes?
No, ma'am.
Okay. Then I will entertain a motion for approval.
Move approval.
Second.
Move approval by Trent, second by Roger. All those in favor signify by saying aye.
Aye.
And those opposed by nay. All right. Then we will move right along with our agenda. And next we have Dr. Duncan up for Human Resource Update and Dashboard.
Okay. I'm going to ask Chris Lyons to join us today. And as he comes up, I first of all would like to just thank the board for all of your support as I've stepped into this interim leadership over HR. Having Dorothy to help guide me through this time has been invaluable. It has been an area that I've not had previous experience in, and I am truly humbled and very much appreciative of both the board and the HR team as I navigate through this. Chris Lyons, a little bit about Chris Lyons for those of you who may not have had opportunity to meet Chris. Chris actually grew up in Azle and went to school here in Texas. And in fact, one fact about Chris you may not know is that he's never had an address outside of Tarrant County. So he is a true Tarrant County citizen. He's been with JPS this upcoming January. He will be with JPS for a total of 10 years. He started with IT, helping the HR team around their IT needs. And then he moved into HR operations as a director, and he now holds executive director of HR operations. So I think it's always important for the board to see the team and the members who actually do the work. We often get credit as leaders here, but it really is the team that does a lot of the work. Chris is going to update us, kind of take a look at what has transpired since the board approved the budget around increasing living wage, doing equity and market review. We already started the work. I remember Roger, when I gave the presentation, asked the question, we often approve these things and it takes a long time for you guys to get started and complete it. And so that day I ran out and said, team, get started on it so we can prove Roger wrong. But I think you will be impressed with the work that HR has done. We will present a dashboard that we would like to bring back to the HR committee, and that dashboard was really put together so that we can begin to measure the results of the equity market review and the living wage increase. So we thought it was a way to keep the board updated as to the results of having completed those different items. So with that said, I'm going to turn it over to Chris. Chris does not have a favorite football team. I know that's important to the board. He enjoys tennis, so for any of you who are tennis fans, you can have that conversation with Chris. So with Chris, welcome here, and we're going to turn it over to you.
Thank you, Dr. Duncan. And if it helps, my family is a Cowboys fan. I don't know if that helps.
All right.
There we go. Good. So, so thank you. So what we want to do today is we want to just go through and, as Dr. Duncan said, talk about a few of the things that we're doing in relation to compensation, with the equity review, the market assessments. And then also we want to talk about a few other topics as well. And the first of those is really going to be around employee well-being. We're going to also touch briefly on our pension plan and give an update on where we are with our enrollment, talk a little bit about our 2022 benefits plan, and it's coming forward this next year. So to start with, really around employee well-being, what we really wanted to kind of highlight was really just the multidisciplinary approach that we take to supporting our team members. The past 12 to 24 months has been a real challenge for a lot of people, for a lot of individuals, for many different reasons. And so it takes many teams across the organization to really support them. And so I know that there's been information recently provided in the details of some of the work that's being done, but we wanted to show more of the multidisciplinary approach between the employee assistance program, our spiritual care and ethics team, as well as our human resources wellness program as well. All three of those really work kind of in concert together to provide support for our team members. Whenever we look at some of the effectiveness of the programs, we get comments from our participants in our wellness program that really helps them look at their weight loss different, and they've been able to really be open and honest about how they manage their weight and about their lifestyle and how they can live healthier. And so we started to really see some impact that we're having on their lives, which is really important. And then also the one thing that we do definitely want to highlight is around our grief support team. And so with the past, like I said, 12 to 18 months, we've had a number of team members that have either lost a loved one or that we've actually lost a team member. And so helping our team members kind of manage through grief and loss has been very important. And so we've got this multidisciplinary team that comes together anytime we have a loss of that nature, and we meet and we make sure, how are we supporting, the individual, how are we supporting the team, and we really have kind of come up with an approach that allows us to kind of tailor the needs of the team to what we deliver to them. So we're real pleased with that work. It's unfortunate work that has to get done, but it's been very well received and pretty well effective. Next, as we go into compensation, really we wanted to highlight, equity and market reviews. And so just as a quick reminder, equity reviews really are where we look internally to ensure that all of our salaries are consistent, and they really give employees credit for their relevant years of work experience, making sure that we've got team members that are making, a salary that's commensurate with their years of experience in comparison to others that maybe have more or less years of experience. And then in addition, we also have planned as our market assessment work was where we start to look externally to the outside of the organization to see where we need to adjust our salary structures in order to maintain our competitive position, from a recruitment perspective. And so with the equity reviews to date, we've already completed 61 of our ICU RNs as well as 257 ED positions or team members. And so we're continuing down that path to evaluate jobs and look at different departments and making sure that we remain equitable within those teams so that we can help improve retention. As we were looking at, how do we really determine which ones do we want to focus on first, we really were looking at what are areas that we have high turnover, what are also those areas where we've got recruitment challenges or we've got a skill set that is hard to recruit for, it is tough to find. And so that's how we've prioritized the effort, and that's why we started with the ICU and the ED teams first. As we move forward, and we are going to also be looking then at completing our market assessments. The market assessments, again, is where we're looking externally, and we compare our jobs to other jobs in other organizations. And so we are engaging a third party, Mercer, to help assist us with that in that work. And as of today, they've completed what we call job matching of 600 of our jobs. And so they've looked at 600 jobs internally and compared those to externally to the other organizations. For both of these, our plan is to have the work completed by the end of the calendar year by December 31st. So we look forward to being able to make those adjustments as needed across the organization, again, to help with retention, reduce that turnover, and make sure that we've got equity across all teams. Our next compensation topic is really around the living wage, which is where we looked at increasing essentially the minimum wage of JPS that we offer to our team members. And so, this is where we're able to really help improve the competitive recruitment position for JPS. So as we look at, other organizations and we look at, what they are offering as their starting wages, we needed to look at adjusting ours as well to really remain competitive. And so that change actually went into effect on September 6th. And with that, we had 937 JPS team members that were affected by that change. And so they received some form of an increase. And that did include 291 of our EVS team members that we contract with HHS. It spanned 93 departments. And on average, it has an average annual impact per employee of $3,203.20. Our top positions that were affected by this are also listed in your PowerPoint deck. It was housekeepers, our patient safety assistants, our multi-skilled techs, our certified medical assistants, and also certified phlebotomists. So those are our top 5 positions that made up the team members that received an increase from that. And then as we look forward to Dr. Tungan's point, what we want to do is, how are we...
Back up.
Oh, yes, sir.
I was trying to save them to the end, but I may not remember them all. Go back, yeah, this slide. On the positions, isn't housekeeping under a contract with JPS? So then we are able to talk to the company to change that in the midst of the contract, is that?
Part of our contract is the salary of those employees. They do the hiring for us, for those employees. And so I guess your question is.
Yeah, well, yeah. So if we're in the contract midterm, we can say, does that increase our contract to say they need a pay raise, basically?
Yes, exactly.
Okay.
They also are included as part of our AIP, so we do see them as JPS members, and so any benefit that we change for any other JPS employee, we also include HHS.
Oh, okay. Okay.
Their employer is JPS.
No, their employer is HHS, yes.
So they don't get the same benefit package that our employees get as JPS are.
They do not.
Are there any other questions before he move on?
Well, I have another question, but it's earlier. I was going to wait till he got to the end now.
Do you want to ask it now before you?
Well, he needs to go back a couple slides. There. So EAP functions under HR, or does it function under what Laura Burnside brought the other week because she introduced EAP also?
Yes, sir. So the Employee Assistance Program in Spiritual Care and Ethics both fall under Patient Experience with Laura Burnside's team. And then the Human Resources Wellness Program is under HR.
Well, question for you. Is this part of the comprehensive look at everything, or we just looking at living wages and all that stuff?
Today, from a compensation perspective, we're touching on living wage and then the equity and market assessment.
Because maybe I'm a little bit confused because company, organization our size may have some challenge with middle management also as well. So I'm not sure that's part of this or not, so that we can recognize and more education or more training, or because sometimes you got turnover and and if they're not satisfied with their boss, they're going to want higher salary, and then they still leave. So I'm just trying to look at the long-term challenge that we will have.
Yes, so the leadership group is one of the groups that we'll be looking at as part of the equity review as well as the market assessment. And so they will be isolated in their own group at the end of the assessment. So we're going to go through all of our frontline team members first, and then we do leadership at the end.
Okay.
But it is scheduled to be done.
Okay, good. Okay, thanks.
Hold on, Roger had a question.
No, let the Reverend finish his thoughts.
Okay.
Yeah. I might be way out of line. I apologize. But I don't understand how we got to employee assistance and spiritual care and ethics, and we separated that from human resources and wellness, and then now part of it's over in patient experience, when actually these three overlap each other. How do we get there?
So as interim leader over HR, Chris, I'll take you off the seat there. So Reverend Emerson, you make a good point. And as we are narrowing our search for our SVP of HR, one of the requests that I've had is that we look across the organization at all programs that affect the employee and bring those under HR. I think like many of the other areas within the hospital, as there was some change that was needed around a program, it was often placed under a VP that may not seem to be intuitive, but in order to begin to strengthen that program. But I think we have matured enough that we can start to bring all things back to where they need to be, and not only in HR, but also in other areas. I'm looking to really bring that. That would also include, we're looking at occupational health, because occupational health needs to sit under HR and work with the policies. And so right now, those two have to sit at the table together, which has not been bad. But when we have new employees coming in that have certain requirements and transactional needs, that should all sit under HR, so. Good point.
Karen, do you, from looking at this kind of from your perspective, which is new to this area, I understand, but globally, are you convinced that those are all distinct and managed in such a way as we don't have duplication and we don't have overlap?
Not clear what you're asking.
So all these programs, you look at Move, Spring, Step challenges, you look at a lot of different programs, each one of which probably has its own administrative structure and cost. And to Ralph's point, because I have the same sort of question, are we certain that they are distinct enough, that their purpose and the money that's necessary to run those are distinct enough that we are not duplicating cost or duplicating efforts in potentially 2 or 3 different areas that are now under 2 or 3 different people?
Yeah, so currently they're under 2 different areas. To Reverend Emerson's point, we have some under patient experience, and then we have some that are under HR. I do see that these are very distinct,
Okay.
But do need to come under one umbrella.
Okay,
But I do see them as very distinct.
thank you.
Okay, Roger.
My question is about the following slide, I believe.
Okay.
That's, go back to where it, I guess go one more.
One more over the last one.
We were talking about the housekeepers and getting to $15 an hour. Are any of, okay, there's a firm that hires the housekeeping crew, right? And we have a contract with them. They are housekeeper employees.
Yes.
Correct. And then as our effort to get a living wage, we went to housekeeping company and said, you will pay your employees $15 an hour.
No, we negotiate that salary at the time of contract as to what they will pay for that employee, and we match that to where we're currently at.
Okay, I guess,
That's all part of that contractual cost.
right, but then I'm presuming overhead and profit for housekeeping company went up some proportion amount. If the wage went up, then presumably whoever's running the housekeeping company, their overhead and profit percentages went up as well as part of that negotiation.
Yeah.
Okay, so then, I presume as part of the contract, we know what those overhead profit percentages are? I guess, are we now paying a housekeeper what, we're paying them $15 an hour, but the cost to us is now $27 an hour? Is kind of where I'm going with that.
So, yeah, no, I hear what you're saying, and I do not have that information.
Okay.
So let me,
Of those other positions that we're moving to a living wage, are they all with other management companies, or are they all, the rest of them are JPS employees?
remainder of those are JPS,
Okay. I'm just curious as to what is now the hourly
the true hourly.
rate for a
Right,
housekeeper.
Right.
Just to make sure that we're getting the best bang for our, I mean, we could hire them in-house. I mean, I'd rather pay them $27 an hour than to pay the company, so that's where I'm going.
Yeah, good point.
Actually, I apologize, because that's why I was trying to reach to. Roger knew that, that's why he asked that question.
Okay, so you'll
Maybe-
get back with that?
I
Yeah.
will.
Yes.
Maybe you answered the question and I missed it, but in the middle of the contract, you have to renegotiate the contract to make a change, right?
You can amend a contract.
Same thing. I
Yeah.
mean, it's amendment, and that's what we did this way? Okay.
And they are coming up for renewal, so they're very close to that. But I think we'll be able to look just into those things you're speaking about, Roger.
Thank you. So Karen, and again, we're putting you on the spot. I apologize because I
That's
know
okay.
this is not your normal bailiwick. Food for thought. When we negotiate a contract for housekeeping or landscaping is another example, do we not want to build into the specifications of that contract initially what that
Wage could be.
comparison should be and where we intend that company to be relative to minimum wage expectations, rather than coming back after we've negotiated the contract and having to amend it?
Yeah, and so I'm not sure that we don't, to be honest with
Okay.
you, Trent. And
Okay.
I do need to look closer at that.
Because to Roger's point, that's a difficult position for us.
Yeah.
Because now, we're not just increasing minimum wage, we're increasing the overall margin on the contract relative to the total of the contract, and easily a $15
No,
increase in minimum wage could be an $18.
no, I hear
Increase in
what
cost of
you're saying.
JPS.
So I'm not sure we don't do that. Adam is not in here. I mean, he oversees that contract. But those are all good questions that I will get back to.
Thank you.
All right. Any other questions before we move to the next page?
Can we go back 6 slides?
No.
I made sure he only had about 5.
I just want to make sure you get a thorough.
Okay, so like we discussed at the beginning, Dr. Duncan mentioned that we have a dashboard that we want to bring forward. So what we're doing is we looked at what are some of the key metrics that we have today that we really feel will be impacted by our employee well-being efforts, by the changes in equity, the market assessment, as well as our living wage. And so these are the ones that we're going to continue to monitor going forward. So starting with turnover, we've got 3 turnovers that we really are going to be focused on. One is around voluntary for all team members, all turnover, and that is both involuntary, or that's all voluntary. And then we also will do voluntary for less than 1 year, and then voluntary for nursing. And so those are going to be our focus points for a turnover perspective. We have provided what our achievements were for the calendar year of 2019 and the calendar year of 2020, as well as our benchmark for Saratoga, PricewaterhouseCoopers. So we annually will report data to PwC on the HR side, and they then produce back our calendar year metrics along with the benchmarks for their report groups. So you can see in 2019 we've seen increases in 2020 from 19 in all 3 areas. Our benchmarks are static from 2020, and at the end of 2021, when we do our next reporting, we'll then have updated benchmarks as well. Other metrics that we're going to be focused on are going to really be around month-end posted vacancies, because we can see from the last 24 months that our posted vacancy number has increased considerably. That's a result of just increased hiring, also due to turnover and our reduction in retention. There's not a benchmark associated with that for organizations, but we'll continue to track and trend and see how we see improvements in it, because we expect for that number to be reduced over time. Also, our average time to fill in 2019 was 43 days. In 2020, it was 56. Our benchmark goal is 34 days that we want to achieve. This is based on the Institute for Corporate Productivity, which is an organization that we've used before that does a lot of corporate research. So we're using their benchmark for that. And then finally, on the employee resilience, is where we're going to track our resilience of our team members through our engagement survey annually. 2020 was the first time that we asked the questions around resilience for our team members, and so we had a score of 4.32, which was actually above the benchmark for the survey provider of 4.20. So we were pleased with that overall number, so we're going to continue to monitor that going forward as well.
Yeah. Can you explain what employee resilience is?
So resilience is is a person's ability to really recover and bounce back from stress. And so it gives them the ability to decompress from work and actually disconnect to say that whenever I leave work, I can leave work at work, and I can go home and I can enjoy being at home and away from work. So there's that decompression component of that. And then the other component of that is activation. And activation is how quickly do I get engaged in the work that I do given the stress level that I'm feeling. And so it takes both of those and looks at them and then comes up with a resilience number of 4.32 to determine, how well do our employees then handle stress and how well do they then bounce back from that stress.
Do we think that this particular environment that we're in right now would be different if we were not in this pandemic situation?
It's why we're measuring it for the first time, because because of what we've gone through, we do find that this resilience, we've got Dr. Ponowitz here, but that this is going to be important for us to be able to monitor and begin to have some programs around our employee. I think Chris makes a good point around the activation too. I mean, once I go home and disconnect, how much effort does it take me to get up the next day and come back to work? So we do know that COVID has truly impacted the employee.
So you could actually say that one line also carries over or carries from the EAP section then.
Yeah, so kind of the work that we're doing around that, kind of how well are we doing with it? And then what additional programs will we need moving forward to address that?
I think we should measure board resiliency as well.
Okay, Sam?
I'm assuming when you talk about turnover metrics, you're lumping a whole lot of different job classifications together. I'm assuming that, though, that you look at each of those classifications separately, because you're going to have more problems with turnover in some jobs than you do in others, and this is just an aggregate right here, right?
It is. Now, the largest body of employees sit in nursing, and so that's why we called that one out. So about half our employees are considered to be within that nursing area. But to your point, you're exactly right. There are some that's normal. Probably your lower wage earners turn a little bit more, as opposed to your more highly skilled, highly paid.
It's hard. I think you guys may, because it's confusing for me, because I'm not an operator, so I don't know. We're looking at exempt or non-exempt employee and all that stuff. And at some point, the stress level and all that stuff, where is it coming from? Is it bubble? Is it because of process that we need to change? Or is it benefit that we need to change? Or is it some bosses don't know how to manage people? So it's kind of hard for me to look at this and understand where the turnover and
There's so much that goes into turnover, to your point.
So are you wanting to see more on the discipline, or, are you asking to see a breakdown?
I'm not sure if we, and I'm just throwing stuff out because I have no
Okay.
idea, right? I'm not sure we approach it from look at and see what's the problem, or do we need to go to the middle management and say, what are the things that we need to provide for you? Because for me, if I see any of my department that turnover that high, first thing I look at is compensation. Second thing is that, are you the right person for that job? Because people may leave for a lesser salary for satisfaction and a peace of mind also as well. So I can't tell, I want to really go down that path, right? That's an operator path. But I think part of the HR needs to take a look at that so that we can provide, we're in 2021 now. They should not be fearful of their job, right? And I think that's part of it. If they're fearful, they move on. So is that, I'm not saying we have that problem, but some organization, when you got a certain size, it does have that problem. And I'm not sure if we're chasing the right current or the wrong one.
We do have certain specific areas in which we have noticed there's been a higher turnover, and so we've stepped in and we've done a little a deeper dive into the root cause of why we see the employees are leaving. And to your point, we do look at the work environment, we look at the leadership, and we look at holistically at all of the different components or factors that could affect turnover, and then develop a plan specific to that department to help address and those issues for them and help support them through it.
That was really why I asked the question about this aggregate thing, because really, as he's trying to point out, each job comes with its own good things and bad things. And when you start to see one job go extreme turnover, then you need to go dive in and figure out what's going on. That's why I was wanting to make sure you were looking at them from a specific instead of the aggregate.
Yeah, and Chris and I have had,
Review area,
Yeah.
I think we're trying to avoid the ocean here.
Yeah.
We focus on one department that has some challenge, and the next one that will bubble up, see if we can nip that, and then.
yeah, and Chris and I have talked a little bit about, right now, the exit interview is optional. Many organizations kind of make it part of the exit process. And so we do not get a lot of individuals who leave who actually complete that exit interview, so we can get a better idea of what's driving their reason for leaving. So we are looking at ways in which we can increase the percentage of individuals who leave, who give us some feedback as to reason for leaving.
Because I've seen situations where, I'm sitting at the top of the organization. I don't see it because they know how to manage up, but it's worse for the employee when you have the same person manage down. That could be a lot of serious challenge that we should be looking at also as well.
Okay. Roger, you had your hand up.
Thank you. So my question is, when were the benchmarks set?
So the current benchmark that's on there is from our 2020 data that we submitted. So after the calendar year is ending, then we provide the data to PwC, and then after their analysis and their reporting, they then provide that to us.
Okay.
So it's as of the 2020 data.
My curiosity is, especially on the turnover metrics, certainly we can get those from neighboring hospitals, and we have to assume that they're pretty much in line, given the pandemic and everything that's been associated with it. That's where I'm more curious about it, is our taking everybody's 2020 data and seeing, okay, what, for voluntary all, are we plus or minus 5 points everybody else? Are they at the benchmark? And trying to, because 2020 is such a crazy year, and most of 2021 is crazy.
Yeah, so 21, we've actually looked at 21, but to Chris's point, the benchmark doesn't get set by Saratoga until the end of the year, so we didn't feel it was apples to apples to bring that forward. But to your point, this continues to trend up, and we really want, first of all, for you to see the trending, which we would expect with COVID.
Right.
That benchmark does look at like organizations, and we can come back with kind of who is in that. But I do like your idea, Roger, maybe even looking just locally.
Sure. I mean, as a peer group in
Yeah.
a smaller
Or
subsection.
closer to
Yeah,
home,
right.
yeah, that we compete against. So.
I think that would tell us a lot more than what we're seeing just given the pandemic.
Okay.
And what we don't know is when we take a look at that less than a year, is that, did they start the year before COVID and they wanted to be, in the medical field?
Right.
And now all of a sudden COVID got here and wow, I don't do that. There are even people that are hired today that may come in, they go through the whole process believing that they want to be part of our organization. And once they start working, they think, I had no idea. Right. And it's like, well, we told you everything. We didn't hide anything from you. But even then they say, I can't do it. So there's lots of different variances that occur. And COVID has thrown in a whole new way to think about staffing. And, I'm sure Karen can mention that, almost every hospital here in Dallas-Fort Worth area has had problem with housekeeping, with techs, with nurses, and so, and part of that is that, COVID has done something really strange with nursing, and they've got the traveling nurses, which means that they get a lot more money for doing that. And so they can be a traveling nurse and come back into systems that they may even have worked at 2 months ago and get paid a whole lot more. So it's in how do you ferret those people out? You have to kind of call them out by name and say, what did they do? Because they may have voluntarily turned over, but they're still working.
Yeah, they still come back, yeah, so it gets to be
They come in
really,
another
yeah.
door.
It's a
So it's like-
churning, metric.
Okay.
Okay, so next what we wanted to do is just give a quick update on our pension plan for our 2021 enrollments, which this is the last year for our pension enrollment. And so currently enrolled in the plan prior to this enrollment period, we had 3,712 team members that were enrolled. With this new enrollment period, we have now 809 new to enroll, and there is an update to your slide deck. So the slides that we were presenting on the screen have the updated numbers, just as a point of reference. So eligible to enroll new this year for 2021 was 809 team members, and of those, we had 470 enroll into the program. We still have an outstanding number of 339, which is just over 41% of those that are still yet to enroll. And so we're continuing our in-person staff meetings, group conference calls. We even, our retirement consultant even has been taking phone calls with family members after hours so that they can speak with both the employee and the spouse at the same time to help them, answer questions. So we are sending email blasts and invitation letters to everybody that's eligible. So we're continuing to engage those individuals as much as possible, trying to get them to enroll in the plan.
Let me get on that plan. No kidding.
Okay, yeah, Trent,
So I want to understand which
plan?
slide is right, because the one on my portal,
Yeah, this one is the updated.
this is updated.
This is
This
updated.
has a lot
Yes.
more. This is
There's a
whole
lot more, yeah, there's a whole lot more,
Okay.
right, so.
Because this number was like, wow, we need to.
I know, I was like, Chris, get this out before the board, then he comes to me and said, I reported it wrong, I'm like, oh, shoot, can we pull the slide? But I feel it's important for you to know. Now, when they went out and did these enrollment tactics, they were able to bring it down from 809 to 470 just by a big push on it.
Okay.
So I think we were able to capture those who were probably sitting on the fence and probably just hadn't gone in and signed up for the pension. But we still do, to your point, we still do have 339 that are sitting out there that are eligible.
So just remind me, Dorothy, when we ended the pension plan sign up, it goes now to basically a 401K
Yeah,
only
yeah,
option?
a matching 401K,
Matching
yeah.
401K.
Is it worthwhile to keep those numbers moving forward after the end of September, so that we kind of know what that profile of who our 401K attendants?
I think that would be great, yes.
Great, thank you.
So would you say that the remaining 339 is that they're sitting there because they just haven't fully understood, or they're resisting? You may not have that answer, but I was just sitting there wondering.
Yeah, we don't know. Chris, do you have any idea? Steve has shared with you.
It's a combination of, I think, several things probably, one of which is lack of understanding of the plan itself. And so that's why we do as many education sessions as we've done. It may be a financial decision in not being able to afford to be able to put money back into their pension or to participate. So, but really what we've found, it's really a lack of understanding a lot of times. And so that's why our education sessions have been so beneficial in being able to host one-on-one counseling sessions with our employees to help answer their questions specifically about their specific financial situation, because that seems to be the most effective way to kind of help answer the questions and help them, make the decision.
Because this is the plan that they only have to put in 2%.
Right.
This is the defined plan where it's only 2% and the hospital pick up the rest. Yes, Trey.
So I think there's probably a correlation, because we experience this in the city business too. There's a correlation between your propensity for turnover and participation in your pension plan, because the vesting period scares some people off. They're not interested in putting money into something that may not, I don't get to touch this for 5 years or whatever. They would rather do something with it on their own 401K, because a lot of them think they're not going to be here that long, which is good information, because that means their prospective ideas about how long they stay at JPS, it kind of becomes clear when you have a low pension enrollment.
Okay.
Interesting.
Yeah, if I can add on to Trent's, I was trying to keep from saying it in profiling employees, but you take those lower echelon employees, they're trying to hold on to every dime.
Right.
Yeah. And then that same employee doesn't fully understand the benefit of the 5 years. You building in your little savings plan if nothing else. So,
And we think that the bulk of those 339 are new employees. Because I think you found that you had some old employees that wasn't in it. So my question would be, of those 339, are they your new ones coming on? Or do we still have some old employees that's been here for 2 to 3 years, still sitting out there and don't understand the plan?
right.
Okay.
We'll take a look at that,
Yeah,
but I think
we'll
that's
take a
good
look. We don't have that information, but we can
Okay.
find
We'll
out.
take a look at
Okay, thanks, okay. Well, I do think you've done a good job of going back, educating those, because that enrollment is closed at the end of this month. So thanks for your effort on that. And I think that was a good plan for us, and I know we had to end it, but I'm looking for the next bit, okay? All right.
Thank you. And then finally, really around our benefit plan update for our 2022 open enrollment. So our open enrollment period begins October 1st and will go through October 30th. So that's going to be our period for our team members to go in and elect their benefit coverage for the next year. And their benefits will start on January 1st of 2022. Changes that we wanted to highlight as part of the new benefit plan year is that we're lowering our lab and x-ray and high-tech imaging pricing for our tier 1. So that's for those that go to JPS and get their x-ray, MRI, CT scans completed. For our flexible spending account participants, we have a $500 rollover, so they can roll $500 over from their 2021 into their 2022 plan year. And then for our team members that are making less than $36,500 annually, we have a zero medical premium for their health savings plan. So we have the PPO, and then we have the health savings plan. And so for those team members in the health savings plan that choose team member only coverage and make less than $36,500 a year, they will have a zero premium. And then in addition to that, for our health savings plan, for those that make less than that $36,500, if they were already in the plan, we are not increasing that premium for that group either. So their premiums will stay static or will reduce to zero depending on their coverage level.
Are they qualified for a connection for the less than 36,000?
I do not know the answer to that question.
What's the question, DT?
For those that make less than 36,500, are they qualified for a connection program?
Sharon, do you have that answer?
They could, it really depends on the, it's measured on FPL, 150% of FPL, so it kind of depends on your family members. But we do have some families who work here that, instead of buying a family plan, they can enroll in connection. But we do have about
connection people to see if they qualify as part of the assistance program.
we have an extremely high enrollment rate in our health plan for our employees. So it's above 92, 93%. So most of our staff are enrolled in our Cigna employee health.
And then the final change is that just,
Are any of our contractors or non-employees able to use these plans?
no.
Just the housekeeping? Are they
No.
eligible?
No, you have to be an actual employee, a paid employee, correct?
But they could qualify for it.
JPS connection, yeah.
Can I assume that whoever is on the negotiation on the insurance for the, assume we self-pay, right?
Self-insure?
I mean, self-insure, are we?
I'm sorry, DT, the
Are
question?
these for the plan that we self-insure for the employee, or
Yes.
Yes.
Uh-huh.
do we have anyone that looked at the medication and match it to make sure that it's part of the formulary for the employee?
So we have a third-party consultant that we work with to assist us in evaluating our plan every year.
No,
and-
let me
and give it
rephrase
to
that. Do we have enough people who have the knowledge to ask for that? To demand that from the benefit
No.
manager guys,
Yeah,
person, whatever.
Yes, our compensation and our total rewards team, that has the benefits team in it, they engage with the vendor on a regular basis around program utilization, and they look at prescription drugs, they look at services that we provide and don't provide, and so, yes, we have the team in place to help have that conversation.
For that?
Yes,
Yes, we do.
Okay.
yes. And then finally, the last change just is that we have a new open enrollment system this year, which we will also be able to provide benefit counselor assistance. So any team member that's going through the enrollment process and has questions or maybe doesn't understand their benefit changes, we've got a live person they can speak to help then answer any questions, and they can speak specifically about their particular health circumstance or condition and see what benefit plan best suits them.
Okay.
And that concludes the content we have, and so we're open for questions.
Okay.
So one of the things that Dorothy tasked me with is, if we're going to give increases in wages, let's just make sure we don't take it away in benefits. And so this last slide really did speak to how we worked really hard with our consultants to make sure that they were not being given something on one end and taken away on the other end.
In terms of the benefit for the employees, is that co-pay deductible associated with it?
Yes, there is the plans do have a copay and deductible structure, yes.
Do you have a certain threshold that we can start looking at to see if we can, because I'm assuming they're going to use network physician specialists and all that stuff. If they stay inside the specialist, like hip replacement,
Yes.
knee replacement, all that stuff, for them to be able to do their job if they are hourly employee, the deductible and copay can take away 30% of their gross income already.
So we do have a tiered plan where we've got our JPS network, we've got the Cigna network, and then we've got then the network that's outside of Cigna. And so then there's a different deductible and out-of-pocket maximum for each of those different coverages. So as an employee who is seeking medical coverage currently with the hospital, if I go to an in-network, which is within JPS, then my deductible and my expenses are at the minimum of the ranges.
At the minimum of the range.
Meaning that of the three-tiered structures, it's going to be the most cost-effective for me to go and seek care at JPS, opposed to going to a physician outside of the network.
Drives it to JPS.
Yep.
I think we may want to develop certain things like center of excellence. If they go to this approved, then we can waive deductible and copay because there's no cost associated with bad debt and collection, all that stuff, and we can lower that for our employee and on the, because most of that goes out to bad debt and collection anyway. It's more like cost containment of certain things for our employee. And then we can use that to expand that outside to JPS connection, and then we can go out and expand that, because we're going to have to look at population health down the road to be able to attract beyond Medicare, Medicaid, and JPS connection, right?
Okay.
Because I know the city of Fort Worth, Euless, is doing that cost containment already.
Yeah, yeah.
Okay. Roger, did you have a question?
Nope. Looks good.
Little hamster's turning is all,
Oh, okay.
but he's slow, so.
All right, any other questions? Okay,
Thank you, Chris.
Thank you very much for
Thank
your
you so
time.
much.
very helpful. I guess my one question is, did anyone see anything else that they wanted on the dashboards, or were you okay with just those three? Okay. Think about it. If you do, just let them know. Okay? All right. Okay, next, you're up for,
We have three policies that I'm asking for approval. The first one is Human Resources 2400 mandatory training policy. This policy does not have any substantial changes to it. There's only minor changes to it. It does not have a procedure associated with it.
okay, do we want to just go ahead and do individual, or do we want to just do,
Yeah, all three of them, HR 4700, regarding our performance appraisals, and then HR 4800, 4800 is performance appraisals, and 4700 is our 90-day orientation period. All three of these were up for renewal with minor, if any, changes to them.
Question on, we're gonna take them all.
Oh, well, no, you can ask your question.
Well, I had a question on 4800, I don't want to take it out of order.
Okay. Well, that's okay. Ask your question, then if it's,
So why did we change our philosophy to basically requiring that employees do the performance appraisal to much softer approaches that they should do the full performance appraisal? Because will and should are big time different words.
Brianna, do you want to speak to that? I actually brought Brianna. Come on up, Brianna.
We softened the language a little because there are times where people don't get a performance appraisal. It could be they've gone out on FMLA or they don't come back. And so we changed it to should because it just gives us a little bit more wiggle room or breathing room. If they didn't get it, that does happen.
So I understand circumstances where something that the employee did would comprise our need to not have the evaluation at that point in time. But it also gives us wiggle room on the backside, which I don't like, which is we decide, well, we just didn't get to it. It's gonna be a couple more months and we'll get you when we can. That opens that door too.
So, let me see if this helps at all. An employee cannot receive their merit increase without having that completed. Also, as far as our equity and market payout, that cannot be done until that is completed. So there are some things that keep incentive from being paid out based upon having that completed.
That makes me even more nervous, because now, because the supervisor did not offer the evaluation when they should have, now the employee's not getting paid accordingly. They're not getting a raise. We've passed the anniversary date now for 2 months. I haven't gotten around to doing your evaluation. That 2 months, I'm not getting my merit increase.
Retribution.
It just makes me really, really nervous, because philosophically, we're telling all of our employees, look, when you come to work here, you're going to get a performance evaluation. That's part of what you should expect as an employee, because associated with that performance evaluation basically are your raises. And if you don't get a performance evaluation, you're not going to get a raise. Well, if I'm a supervisor and I've got a whole lot of folks and I just hadn't had time to get to it, under this wording, I'm opening the door to that being okay. And that makes me nervous.
I don't know if we're regulated by any government, auditing body or not.
We were by this policy.
You know, for me, if I don't have this, I would not pass SOX 2 Type 2 compliance.
If you didn't have the word will as opposed to have the word should.
If we don't have the performance review in a
Right.
timely manner, it's done.
Will.
It's part of the,
I guess I'm concerned that the shall, it shall happen. We are wanting it to occur. And if we are saying this is what we want, I guess I'm trying to understand, you had shall, and now it's
Went from will
to should.
Should,
Should is a much softer word.
yeah.
Yes.
Okay, so I can speak to the fact that, and Chris Lyons as well, that we do audits and it's escalated if the performance, there's a performance management system and they can go and see and run reports to see which ones haven't been completed. And there is a process in place for any leaders that are behind or delayed, and they do follow up on it. And I think when it reaches equity market assessments, it's escalated and there's another process in place. But they are in the middle of an audit right now regarding this.
So is it part of a supervisor's performance criteria to make sure that all the evaluations are done according to the policy?
That's my understanding. I do know some leaders that are being held accountable for it right now.
And if that is a part of their requirement, their criteria to be supervisors, haven't I just given myself the ability as a supervisor to say, well, it doesn't say I will do it, it says I should do it. And I'm gonna do it, I just ain't had time to do it yet.
Yeah, the procedure itself, Rihanna, I believe, actually states the frequency of appraisals, and it still says will. So the policy, yes. The policy at a high level is that all employees should receive annual performance appraisals regarding these things. And then the procedure itself digs into the specificity of that, and it does say frequency of appraisals, all employees will receive a performance appraisal on or around their annual appraisal date, and it talks about the policy for doing all of that.
Well, then I'm not in favor of changing the word here.
Leave it, it will in
Yeah.
the policy.
How would we leave them both the same?
Yeah, no, I mean, we at the board are adopting policies that are supposed to be then reflected in procedures throughout the entire organization. And we just made a statement here that completely undermined the procedural statement that you made.
Yeah.
I agree.
Is there a way to put in except in circumstances due to employee or something?
I think
We try to be very high level in the policy language, but I think what we will do is to table this one, we'll take it back, and unless there's some reason as why we cannot reinsert the word will, we will bring it back with will.
Okay.
I think it's a good
Whatever
point.
you need to do, I'm just.
Likely, we could reinsert the word will and talk about those things that might not require one to be
In the
done, or
procedures.
that
Yeah,
wouldn't be a
can be the
must.
procedure.
Right,
Yeah.
right.
We could pass it for will.
If we just change the word will, that's all we're saying is change it back to will.
We will do that. No, thank you, Trent, I think that was great
Okay.
conversation.
So let me go back now, and so for HR 2400, you're okay with that one? And for, and for the 4700, we're okay with that one, okay? So can I get a motion to approve those two?
Move for approval.
Okay, by DT, second by? Okay. Dr. Coleridge. Okay, all those in favor of approval of 2400 and 4700 signify by saying aye. Those are not approving it by nay. And we will pull 4800 and bring it back. Or we, to me, y'all just change the word and we could move on.
That's what I would do.
I'd make a motion that we change the word back to will and adopt it with the word will.
Okay?
I'll second that.
All right, we got a motion and a second. Motion by Trent, second by Zim. Are there any other discussions on this? All right.
Daphne, you had brought up that there may be other pieces that prompted them to do the should. Is that correct?
Well, I was just saying that the procedure itself actually does still have the word will in it. So we could, make the changes that we were trying to address by changing the word in the policy. We can make those changes in the procedure.
No, you don't have to.
Okay. All those in favor signify by saying aye. And those that oppose by nay. All right, motion passes. All right. Okay, and next I have the resolution authorizing the amendment of the JPS pension plan. I want to go into closed session on that and before on that one. That is okay, right? We can do that in closed?
Yes, because you're going to be discussing particular.
Okay, all right. And Sharon, you want to present something on the discretionary 403B employee benefit for us to discuss?
So, we have been trying to address some of the non-participation in the pension plan and some possibilities that it may be miseducation, it might be, and I think Chris, brought this up as well, it might be the employee may not feel like they can afford it to put anything back. So what we would like to propose is kind of a $10 a pay period discretionary 401k contribution that does not require any participation or cost to the employee. So it's about $260 a year that would be put into a 403B account for any employee, regardless of whether they participate in the 403B currently or not. So this will be an additional benefit to those staff, and hopefully addressing some of the employees that don't feel like they have the extra money to put anything into a retirement plan.
This would be across the board for all employees to get the.
Yes, that, and when we do that, it would cost about $1.5 million the first year. What I suggested was it's similar vesting, so you don't get to take it with you until you've completed 3 years of service. And so the first year of the plan is philosophically the most expensive, because as employees leave, as you saw some of Chris's data, we have, 25 to 30% turnover rate. So as those employees leave, the contributions that they leave behind in the plan are referred to as forfeitures, and those offset future year contributions so they can be redistributed. So I don't have the exact numbers until we get through the first year of the plan, but the most expensive it's going to be is $1.5 million. And then as years go on, you might have $350,000 left as employees turnover, so that would reduce that $1.5 million. But currently, we have about 5,800 full-time employees from the Acclaim side as well as the medical center in the foundation.
So let me ask a question on that.
Yes, ma'am.
You already have a defined benefit plan for employees that they are in now. They can decide the 304 now. So they're already in a pension plan. So you're saying, okay, let's open up a pension plan so for everybody can get $10 a month. I'm more concerned with what we're doing with the ones that can't get in your defined benefit plan and don't have money to do anything. I don't think I want to, I'm a little concerned that it's for everybody when those others are already in something, okay? Mm-hmm. So I'm thinking that that's a plan that's there, already going. And so for employees starting with JPS after our defined benefit plan, that is what I'm looking at. What can we offer them? Because I'm not seeing that the rest of the employees should be a part of that.
Okay, well, part of my thought process, and of course, this is the first time the committee's hearing about it, so anything can happen. But if you started prior to 10/1 of 20, then you are eligible to join the pension plan. And currently, we had about an 82% participation rate. Now, with this last push, we've gotten that up to about 92% participation for all eligible employees. To participate in the plan, you have to contribute 2% of your salary. You also have a 403B benefit that is a laddered vesting after 3 years, where if you contribute 3% of your salary, you get a 3% match. So for employees that are hired after that date, we increase the 403B match to a competitive market rate of 5%. So if you contribute 5%, you'll get a 5% match. So both plans to get your full retirement benefit do require you to invest 5% of your earnings to get the retirement benefit, whether it's split between the 403B and the pension or it's all in the 403B. So when I ran my numbers, I didn't differentiate between that enrollment. Now, I will tell you that those employees that were hired prior to 10/1 of 20 that are eligible for the plan, we only have about a 57% participation rate in that 403B. After, we only have an 18% participation rate in the 403B. So when you look at the 403B benefit, we don't have a really high level of participation in either the before, after pension eligibility, however you want to look at it. So, you know, about a quarter of our full-time staff have been hired after 10/1 of 20. So it's really, you know, up for discussion.
Okay. All right, Trent.
So if I understand this item correctly, this is something staff is introducing as a discussion item. There's no action to be considered here, right?
Correct.
Because I want to see it. I mean, I'd like to see it in writing. I mean, typically, the details that we have on these others are always articulated in a policy that we get a chance to read and review. I may be okay, Sharon, with what you're talking about. I'm just not okay
Right.
in its current form on the agenda.
we just
I need
want
to
it.
see it and
It's
understand
supposed
it.
to be for discussion. I think.
Yeah, right.
Yeah. And for us to write something, it would be helpful if we understood your idea of how you would like to see it drafted. Is it only employees that would be, hired after 10/1 that would not be eligible for the pension plan? Is it all full-time employees? That just some of the basic questions that we're having today will give us enough to go back and write it and have a resolution for you next time.
Well,
Go ahead.
well,
Go ahead.
well, my uneasiness is that it's on the table for discussion, but I don't know what I'm discussing. And so I feel more comfortable. I don't know where the idea came from, but wherever it originated, I would like to see it come from that impetus of what created it and bring it to us, and then we look at it.
Options at least to
Yeah,
articulate
yeah,
them, because
yeah.
I can't, I'm like you, I can't give you decent feedback on this until I've had a chance to review it and look at options staff recommends and
Yeah.
just.
Well, let me kind of put a little explanation out there. I had talked to Sharon and said, when you end the pension plan, I'm concerned that if a person doesn't put something in, we're going to have a lot of entry-level employees that won't have anything, even if they work here 15 years. So what can we do? And so this is just one of those ideas that she came back with and said, this is what we could do. She had all the employees on. I was just asking, you have a plan that says it ended, okay? You're telling people that's qualified that it is ended. The ones that started, can't get into it, I'm asking what can we do for them who, I'm just going to say, if you are coming in and you are $10 an hour, you need every dime you have. It is very hard for you to say, I'm going to give up more than what you've taken out for Social Security and Medicaid out of my $10. I'm not getting 10, I'm only getting 8. Now you want me to give you another 2%. I'm just saying, can we look at something else where an employee coming in that kind of, I think if they look at some of these others that they didn't, they won't be all new. You're going to have some long tenure employees in there that's been here 3 or 4 years that haven't taken advantage of it.
That's a good, noble idea that I would probably say, I'll support that all day long. I just want to see it
right.
written out so I can look at it and hear the alternatives and
Right. Okay.
discuss it in a manner that's more than just
Right.
hearing it.
Okay.
Yeah.
Philosophically, I agree with the concept. There's just a couple of other things besides provide that one for those early workers or the low workers. It is one of the, it's a perk that nobody else would have. It's another tool to incentivize people to stay. It's just one more thing that's, and if it costs $1.5 million the first year and we get through with $1.2 million the next year, and we see that we have less turnover and we have more retention, I mean, whatever we can do in this environment to keep people here, because people are leaving here to go do other things rather than medicine. I'll go drive Uber, right, you know? I mean, I'll go to San Francisco and move the stuff off of the big ships.
Not San Francisco, some other place.
Yeah, well,
So my question is, well, my thoughts are all over the place, but I think the reason we have low participation in the 403B and all these other things is it is so damn confusing. Like, it has to be easier. And I don't care if you make $20 million a year or you make $4 an hour, it has to make sense. And right now, what you're telling me makes 0 sense, because I'm not sure of the impact of $260 a year in a retirement account is going to mean to somebody. I mean, in 10 years, it means a lot, but if I'm going to leave here in a year, it means absolutely nothing, because it's probably going to cost me more money to figure out what to do with that money than to actually get the money. But if it's $1 million, you said with 5,600 employees and it's $260 a year, that's $1.5 million. And so we're going to put $1.5 million and we're going to pay the bank people $1.5 million, and the balance of that account is going to be basically nothing for year one. Is that how I understand it?
You would not be able to take it with you for 3 years. If you are an employee who has less than 3 years of tenure, then you would not be able to take that when you left. Much like the matching, if you did participate in the 403B that we have today, let's say I put 3% in, I stayed here for 2 years, I get to take my 3%, but I don't get to take the employer match of the 3% until I vest at 3 years.
Okay, you lost me 2 sentences ago.
Okay.
So I think when we're looking at benefit packages, I think that we do a really good job of trying to get cute and define the actual way. I think we need to step back and look bigger.
Okay.
You know, and I'm thinking, we're a hospital system. We have 7,200 employees, or 5,600, and then plus contractors, I'm assuming is what makes that up.
Part-time.
How can we figure out a way to give our employees and families free health care? That's a benefit.
I think you're right. I think we can go back and I think that it ties into the deal that I wanted to talk about in closed session, is saying, and I don't know, we probably need some help in helping us define that, look at that. And we do need to look at it broader.
Sure.
And so I'm all for that.
I want our benefit package to be impactful
Yeah.
and not confusing and not costing more than what we're, actually doing and whatever else.
Yeah.
And we should aim for those. I mean, it's a huge, goal or aspiration, but those are the impactful things. And if we can do that, then retirement is there's an easier pathway. So that's my thoughts.
All right.
I think what we're saying is that this needs to have a whole lot more thought.
Yeah.
From a global standpoint than it's gotten so far.
Okay. I think Sharon, you understand what we are talking about. It's broader than just my little thought. It's now expanding. What can it be? But what I would like to do is expand that also into the item that we was going to do in closed session. Just look at expansion and broadly on what we can do with that and how we can approach both of them. Then I don't have to have a closed session if y'all are okay with that.
May I add one more thing? Because I
Yeah.
think Dorothy makes a good point that we may be overlooking, is that often people don't think about investing in their retirement or preparing for retirement until it's too late. And I mean, I was fortunate that my mom said when I got my first job, find out how much your company's going to match you and do not leave money on the table. And put all your raises into your retirement plan. So my mom scares me more than I scare others. So I did what she said, And so I'm well prepared for retirement, but I do think that that advice is often not given to the average employee that we have. And so this was a way to kind of jumpstart and for them to kind of look at it and say, wow, $200 now has gone to $250. So I do think there is some value in continuing to look at this, but Roger, to your point, I do like the idea of stepping back and having a great benefit package.
Well, I mean, we talked in budget about millennials and how to attract them and how to retain them. And we all know that it's about now, right?
Yes.
I mean, it's about now. What can we do now? Then you couple that, you know, with a big impact maybe on health benefits, and then you simplify that, then you can take that conversation into retirement and how do we help you and set you up for success that way.
Okay, all right. Okay. Thanks, Sharon. Thanks for bringing it. Okay. What I would like to do now is to close our open session and reconvene in closed session just for this, on the pension plan. Yeah, and that will be brief, okay? If y'all let me be brief. Yeah, okay, all right, okay. Who all needs to be in here? I think everybody needs to leave except the board, and you have to stay.
Nice try, Daphne.
Grabbing her little stuff, yes.
Which board? You have to take the shot before it expires, 153.
What are you talking? And we only had one item, and that was with the, oh, I'm on the wrong page. I done went back to Finance Committee. I'm thinking, where's my stuff? We was only have one item, and it was under 5D. And so, we have the plan for this is to bring in set up an independent board committee to look at what this should be, educate us on a broader plan, what we should be doing, who all should be a part of that, and then work on that and then come back. Okay?
And let me ask a question, Dorothy. I mean, I think all of us are suggesting that there needs to be a higher level of review and a higher level of professional advice for us.
Yes.
As independent.
Mm-hmm.
And we
Yes.
haven't really we have that for all of our other benefit programs, but for this one, we don't.
Correct.
So we need policy guidance, and we need professional help to be able to work through that. And whether that's this committee, Dorothy, or whether it's another one, I don't really care. I just want to make sure that we've got a professional that we can bring in and help us get where we need to be.
All right. So, unless that, we didn't have to have that in the form of a motion, did we? That's just.
No, but it sounds like you're declining to enter into the resolution at item D.
You're correct.
Declining to approve the pension plan amendment that was the item.
Right. Yeah, we are. Okay.
So, but I'd like to put that in motion.
Okay. All right.
I would make a motion that we direct staff to provide us alternative professional support toward working toward an executive compensation study that will help us to identify important information to which future policies are going to be determined.
Okay.
However we want to word that, Daphne. I just want to make sure it's on the record that we want staff to go find us the right consulting group to come help us work through this so that there's actually a policy at the end of the day and we're not doing any more harum, random, pull it out of there.
We need staff's assistance in putting together where a board committee can.
I would say that we need to have the staff survey experts in this area and come back to us with not one, but maybe 2 or 3 recommendations.
That's perfectly fine with that. Alternatives, if you will.
And then a board committee can make the decision on which.
Right, okay. So that was in the form of a motion from Trent,
Second.
second from Zim. Is there any other discussion on that? All those in favor signify by saying aye.
Aye.
Aye, motion passes, okay?
Somebody going to wait around here for Reverend to get back to let them know we're finished?
Oh, wait a minute, there being no further business, we are adjourned.
Is there a way we can have a compensation for the board?
Yeah, cookies. We already have
Got
that.
that one. Thank you
You
very much.
already got your
Yeah.
cookies.
Can we find somebody to look at it? No, just kidding.
Are you asking for a little pie, because you have cookies, so you can have a pie?
We want to evaluate to see which better cookies.